You're tuned to Radio Kidnappers, the voice of Hawke's Bay. This is the homeopathic program. It's our pleasure, as always, to have in the studio Heidi back from Thrive Homeopathy in Napier. How you going, Heidi?
I'm very well, thank you. I'm trying to stay as warm as possible.
I don't blame you.
It's that time of year, but...
The weather has been awful.
It has.
And it is all about keeping warm, and it's the season for coughs and flus, which coincident is what we're going to talk about today.
Exactly. There have been so many people coming in lately with coughs and colds and flus, and it's just been full on. And so I thought that's a very appropriate topic to touch on today. I
was reading somewhere that the over-the-counter remedies you can get are pretty hopeless. Really, just got to really ride it out. Is that the case? Or?
Oh, I hope the pharmaceuticals aren't listening. Huh? Well, no, I think it depends on what we're talking about. There are some over-the-counter medication, especially for small children under the ages of 2. They've actually had to write, careful, do not give this to young children because it can be very dangerous. And yeah, if I look back in my younger days when I wasn't into natural and alternative medicine, you just soldier on, you throw in whatever you need to throw in, and you just keep on working. But if the body is compromised and is responding with a cough and a cold or even a flu, which is then a severe form, then you do need some rest and maybe a good broth and some time out.
Is it that simple?
No, it's not that simple, but that's definitely what has to be done as well, and not just throw in some strong medication that keeps you going and soldiering on.
So probably you are best, in fact, to say, look, I've got a cold, I'm just not coming to work for 3 or 4 days, stay in bed, like you say, have some fresh vegetable soup or whatever you're going to have.
Potentially, yeah.
And write it out, yeah.
I remember my grandmother would always say, it comes 3 days, it stays 3 days, it goes 3 days.
Yep.
And that is actually a healthy immune system doing its job. You recover quickly and, you're fine. That doesn't mean that you're in bed for 9 days, but, if you take care of yourself, avoid sugary foods, alcohol, the smoking, all the bad, good stuff.
Common sense.
You will recover quicker. There are also some things like vitamin C that will boost your immune system. Zinc, I like to recommend a combination of zinc and vitamin C because that boosts or supports the mucous membranes, the zinc. So just for that time when you're catching or dealing with the cough or cold, then that's a nice support as well.
So what you're saying sort of sounds to me like that, you've got the 3 days coming up, you've got the 3 days when you got it, then you've got the 3 days when you're getting over it. You just got to write it out. So why would you bother taking any remedy over the counter or homeopathic?
Well, because the signs and symptoms can be pretty debilitating sometimes.
Sure.
There could be a fever, could be sweating, not sleeping well, the headaches, the congestion. So you don't have to suffer through that time. You can support yourself by taking maybe some honey, some thyme from your garden, not thyme, salbei. And there's so many herbs and plants that you can take. But obviously, as a homeopath, I highly recommend homeopathic medicines to support you. Yeah.
I just wonder, one of the things that I hate about getting a cold is the dripping nose. And I know that you can go to the chemist and you can buy let's just say it's Actifed, and it dries you up and it stops your nose dripping. Is that a good thing, or should you just let it come out?
Well, the thing with pharmaceutical medication, all medication basically will force the body into some kind of action, reaction, or suppression. But it's not dealing with why do you have that dripping nose, right? Or why is there congestion? Why is the nose blocked? Why are you coughing? Why do you have that tickle that makes you cough? So the medication you're talking about will just basically stop the sinuses from doing what they are supposed to do, and that is clearing out bacteria and dealing with viruses and germs. So the body is doing what it's supposed to do, but the drugs then say don't do that.
Is that prolonging the cold by doing that?
It can. but it's probably not helping your immune system learn either to recognize the germs and to memorize them so that when they come your way again, you can deal with it. So my recommendation is more to take something to boost and support your immune system so that you can deal with it naturally, or on a homeopathic level, find a substance, and that's the principle of homeopathy, like cures like, a substance that would cause these similar symptoms in a healthy person. And for example, that runny, drippy nose potentially could be allium cepa. So that is a remedy everyone will understand. If you chop up an onion, that's what allium cepa is, the common kitchen onion. If you chop that up, then you usually have a dripping nose or burning eyes.
Yes.
And those are the sensations that you were describing when you have a cold, possibly. So the homeopathic version of it, so I'm not saying go home and chop onions when you have a dripping nose.
Yep.
That's not going to work. But if you use the homeopathic remedy, instantaneously, and I've had this, my grandmother had that dripping nose. It was like a waterfall.
Yeah.
And she was complaining, so I gave her the remedy. And 10 minutes later, she says, "Oh, now my nose is blocked." Do you have
I can't win.
Yeah, that was quite funny.
I wonder what's the difference though. Here we have a completely natural raw onion. You think that you wouldn't get any better than nature.
Yeah.
And you're saying that the maybe the dried out version or the homeopathic version is
Yeah.
better. Why is that?
Well, to be honest, I don't know how that works. That is really hard to explain why these substances. But if you take these substances in their natural form, they will cause symptoms. And Hahnemann, the founder of homeopathy, he found a way, because he experimented on himself, taking minute doses of various even toxic substances, and he would then experience symptoms. And he thought, well, these crude doses are possibly also unhealthy. But then he found, by diluting them and succussing, which is a form of vigorous shaking, basically the information and essence of that substance can be transformed onto the solution, the alcohol substance, or the milk sugar pilules and tabulets. And then by taking that, then it's more an effect of a resonance and a stimuli for the body to react. And so I guess that's just a different approach than taking that crude substance.
Is every homeopathic remedy a minute version of the original?
Yes, yeah.
So even the onion, it's a much reduced potency
but
of it.
then we have the potency, and the potency is then basically the strength of it, how effective it is, if it's more on a mental, emotional, or more on a physical plane, or on both. That's how we distinguish which remedy to use. So if you've just got that simple symptom of that dripping nose, then we'd probably go in a lower potency because it's a very physical. If there's a mental, emotional component as well with your illness, we might go a bit higher. Yeah.
Now, because it's the winter season, we obviously will expect to get a cold. Maybe it will develop into a flu, although it could be just start off as a flu. But there's also pneumonia, and there's also a problem that we have, a respiratory problem all year round, and that's asthma. Are we going to treat them all the same or differently?
Well, the thing about homeopathy is that we don't treat the disease. We treat the person with a dis-ease, so with the illness, with the discomfort. And each and every person is different. And if you have 3 asthma patients in front of you, yes, they will all have that difficulty breathing, maybe a sudden onset, but it will still be different for each of them. Some will say the cold, damp weather brings it on. The others will say, mine starts after intense exercise. Mine starts after emotional upset.
Indeed.
So then that trigger is different for these 3 people. The 3 people in themselves react differently. One might really get that acute panic of, oh my God, I'm going to die, I've got this asthma attack. The other might stay a bit calmer, but is more maybe needy kind, the children that really want
Yes.
the cuddle and mommy and hug, as opposed to the other one freaking out and going all hysterical, right? And so the reaction of a person, the causation, and then also how they react when they are wheezing and coughing. What does the cough sound like? Or the inhalation. Is it wheezing? Is it barking? Is it croupy, ropey? Is there any mucus? All these things will be considered when you find the right, best-suited homeopathic medicine. Over-the-counter medicine, asthma is just, here's your preventative, and here's when you have your asthma attack. They're color-coded. It's the same for everybody.
It's one size fits all.
Yeah.
But not homeopathically speaking.
Homeopathically, no.
So those three scenarios that you mentioned, they will have different treatments.
No, not treatments per se, but different homeopathic medicines.
Sure.
Yes.
Okay, and a lot of people, of course, have asthma, like I say, all year round. And those inhalers that we loosely mentioned there, they're preventatives, which probably some people take every single day of their life, just in case they're going to get asthma. Is that what would happen with a homeopathic remedy, that we'd have a preventative remedy that we would just keep taking? Is that how it works?
No, because, again, the difference is that preventative is just suppressing and managing your symptoms and your problem. The homeopathic approach is, yes, we will have remedies in that acute state, then take that. But then we also look at the overall picture in health and the mental emotional state of a person. What are your triggers? What are your worries? What are, what makes you happy? What upsets you? All these things make you as a person. And that would then be considered in a deep consultation to figure out, is there a remedy that will work on a deeper level to stimulate your immune system to overcome and lessen the severity or how often you get the asthma. And by taking that a few times or for a certain period of time, hopefully you don't even... Some people have been healed of their asthma, which I'm not even allowed to say, but their respiratory issues have disappeared.
Yes.
After taking homeopathic medicine, and it's probably coincidence, as some people would like to say, but whatever, they're happy and healthy, so that's good.
I wonder, though, as a young man and as a child, I had asthma.
Yeah.
And when I finally got onto the blue inhaler, which at the time was the strongest inhaler you could get, it was instant relief. I could breathe better. And one time I had it so bad I needed to go to hospital to have an injection. I thought, wow. Why can't I have that syringe at home? It was just fantastic.
That would be great, yes.
So, and I mean, and you mentioned it, that when you have severe asthma, you think you might die.
Yes, yeah.
And if you've got that inhaler with you, you pretty well know within a minute or so you're going to feel a whole lot better. Would that be the same with a homeopathic remedy, that here I have this serious asthma condition, I reach for my homeopathic remedy, am I going to feel good almost straight away?
If you get the right homeopathic remedy in acute scenarios, yes, it does work very quickly. But asthma is a major health risk. And do not get me wrong, I am by all means not saying do not use your inhalers and homeopathy is better. No way. But what I am saying is that the idea is to have that at hand when you need it. All medication is valuable.
Of course.
So when there is a health risk of possibly suffocation through asthma, definitely take your inhaler. But there are so many people, as you've pointed out, that are on a preventative for years just because...
They become...
Years ago, I needed it, so I've just stayed on it.
Yeah.
And I think that is probably not a healthy approach. It would be much better to try and find out what are your triggers, how can we support the body to overcome it so that we don't even need a preventative ongoing for years.
And that is a great thing about coming to see you, that you look at it from a holistic point of view. We don't just come and say, I've got asthma every now and then. You say, take this, off you go. You almost psychoanalyze me, don't you?
Yeah.
You'd make me sort of sit down, not lie down on your couch, so to speak. But yes, you do spend quite a bit of time finding out what are the root causes.
Yeah, definitely.
Now, we know that asthma is a severe problem, and many people do have it. So, and you often say that homeopathy is complementary to traditional medicine in a lot of cases.
Absolutely.
So with colds and flus, now flus are much more serious. So are we saying the same thing here, that obviously we take time off work, it might be more time, but we could get through a flu purely with homeopathic remedies?
A flu, as you say, is severe. Initially I was thinking about colds. So a cold and a simple cough is definitely something where you can risk just trying homeopathic medicine and other natural things, expectorants that are natural. And then if it doesn't work, then you can always go to the pharmaceutical knockout drug or whatever you need. That's my approach. Where it's not severe, start simple. If you get pneumonia or, really strongly ill, or you are elderly or a very young child, and there are severe cases, then there's no time, and it's not a good suggestion to say, let's play around and see if we can find that right remedy. That would be
crazy.
Absolutely, yes.
Now, the next step up from the flu, of course, is pneumonia. So would we maybe take homeopathic remedies as a complementary to traditional medicine, or would you be suggesting, look, let's go to the hospital, let's go to the doctor?
Well, when pneumonia is there, you definitely, in the meantime, you're so severely unwell that you should be seeing your doctor, getting a diagnosis, and to see what bacterial infection is going on there. And there's no reason why you can't go double. The homeopathic medicine will not weaken or influence the antibiotic that you will be put on. So you can still go both ways.
Some of these remedies that we were talking about earlier, I quite like some of them. I mean, licorice root, who wouldn't like that? Chew on that.
Well, it won't taste, but if you have it homoepathically...
You don't get to chew on it.
No, you wouldn't taste any difference.
Does it taste the same, or you don't taste it?
No, they all look and taste the same. They're tiny white little milk sugar pillules, and...
Like a Chinese smorgasbord, they all taste the same?
They all taste the same, yes.
Oh, no. But what about the peppermint? They taste the same?
Yeah.
Wow. Because they all come as a pill, don't they? Do they come as a pill?
They usually come as tiny white pills, but you can also have them in tablet form, like little round tablets. Then sometimes we put them in alcohol to take as a liquid. So the form is different, but the taste and the appearance is always the same, no matter what substance it is. Homeopathic medicines are usually mineral, animal, or plant-based. So you would not be able to distinguish by looking at them what is what.
Are there people listening to this program, they might be saying, wow, I would have thought that if I was eating peppermint or eating oregano or thyme or ginkgo or licorice roots like I used to do, they might have thought, I've sort of been having homeopathic remedies, but they haven't at all.
Well, if you're taking these substances as a tea or herbal extracts or in a supplement capsule, then that is a naturopathic approach.
Yes, and what's the difference between naturopathy? How do you say that?
Naturopathy and homeopathy.
And homeopathy. What's the difference?
Well, naturopathy is more of an umbrella, broad term. So if you go and see a naturopath, they will all probably be working with different approaches. Some will specialize more in the diet, nutrition, and supplementation. Others might incorporate Reiki and massage techniques. And so there are lots of different options amongst the naturopathic field.
Whereas you're a specialist.
If you go to a homeopath, you will get homeopathy.
Yes, indeed.
In saying that, I do, for example, and many of my colleagues use some herbs or tissue salts or Bach flowers or other things, supplementary advice or products as well. But that is more as a support for the body or cleansing or organ support. But homeopathy is then the main. And that means that the substance has been diluted and succussed and made into a homeopathic.
Just about out of time,
medicine.
Heidi. We're going to have a song very shortly. We're going to have your thought for the week, but just maybe recap about homeopathic remedies and coughs and flus and asthma.
Wow.
We
Okay.
haven't got 20 minutes for it.
All right. Well, first of all, I still think it's most important to take care of yourself, to consider your lifestyle choices, and accept when your body is showing you symptoms that you possibly need to have a bit more rest, to eat a bit better, to get good sleep, and just to take it easy. And especially in winter, keep warm, no running around barefoot, getting wet. Yeah,
That's the bottom line, isn't it?
it is. And then when you do get sick, think about what is the cause, what are the symptoms, what can you do? Is it viral? Is it bacterial? If it's a viral infection, then you don't need antibiotics because they won't help you at all. They will weaken your immune system. So then you need to ride it out with some other products, not antibiotics. And what else? Can try homeopathy for the simple coughs and colds yourself. If it's a bit more complicated, go and see a registered homeopath.
Yep.
Who will hopefully be able to help you really quickly. And if you are in doubt, if there are any problems, risks, concerns, other underlying health issues, then by all means go to the doctor. Do not
muck around.
take it lightly. No.
Now, we want to come and see you because you're a registered homeopathic practitioner. Where are you?
My clinic is on number 1 Lambton Road on Hospital Hill in Napier.
And your phone number is?
021 33 5233.
And you have a website.
I do. Thrive Homeopathy, because that's the name of my business.
Indeed.
Thrive. I want everyone to thrive.
We're thriving just talking to you. And you've got a song for us.
I do. I love Steve Miller
Same.
Band way back in the day, and they have a song, Wintertime.
And your thought for the week is?
No winter lasts forever, and no spring skips its turn. So we will have sun again and warmth and...
We will indeed.
Yes.
As always, our pleasure to talk with you, Heidi. You look after yourself. We'll talk to you
You
same time,
too.
same place next time.
Thank you, Ken. Bye-bye.